Hi, my name is Christine Jacobs. I'm in the fall semester of the veterinary radiology class. My student ID is 3312670. This is one of my preceptors, Brandy Bearden. She's a CBT, and she'll be asking me the questions.
Okay, what is a radiation monitoring device called?
Dosimetry badge.
How does it work to measure exposure to radiation?
It measures the ionizing radiation. It is a film encased in a plastic case, but it is light sensitive, so you want to keep it away from the radiation as well as direct sunlight.
How do we obtain readings?
We send it off biannually to get it read.
And when should it be worn?
Anytime you're taking x-rays.
Where should it be worn when taking x-rays?
Usually up around the collar facing out, so the badge gets the most amount of scatter radiation.
What is the MPD for veterinary staff annually?
Annually, it is 5,000 microrims.
Using a dosimetry report, show yourself interpreting the dosimetry readings for one team member. Explain each column and state the readings for those columns. Be sure to zoom in on the report so the instructor can read it, and state if he or she is below the MPD for the year.
Okay. So for D1's show, okay, it's different then. So for ours, we'll put it as Brandy. Due to me being pregnant at the beginning of the year, I am not on this list this year. So Brandy's is at 27 for the deep, which would be the tissues, 27 for the lenses of your eyes, and then 25 for the shallow, which would be all the internal tissues. So she is well under the dose for the year.
All right. List and explain the 3 methods of restraint used in radiology.
So you have your chemical restraint, which would be sedation or fully anesthetized. The next would be mechanical, which would be using things like the V-trough or gauze or ties. And then your third would be manual, which would be a tech actually restraining the patient.
Discuss and show 3 positioning aids that are used in radiology. You will demonstrate usage of these aids when taking images later in the video. Okay.
We'll do that for you.
Okay. Discuss physical protective barriers that can be utilized in the radiology suite other than PPE.
So another barrier would be collimation, because that helps bring your radiation down to one point and you get less scatter radiation with it.
Explain how distance and the exposure time setting on the machine can be utilized as safety measures.
So the further away from the machine you are, the less likely you'll have exposure to the radiation. You can use less exposures then by having less people around it, and it takes less time then.
Explain why no portion of any human, shielded or unshielded, should be exposed to the primary beam. Do not simply state that no one should be exposed to the beam because it is dangerous.
So you don't want to be exposed to the beam at all, because that is direct radiation on yourself, and that could also then ruin the view of obstructing one of the diagnostic images for your patient, in which then you have to take another one, exposing them more. And we should not be exposed to radiation in any circumstance.
Explain why non-essential personnel should be removed from the x-ray suite during exposures.
The less amount of people you can get in the radiology room, the better, to less the exposure of everybody.
Explain why we should make every effort to obtain diagnostic images on the first exposure.
You want to do that due to it's less stress for the patient, for less manual restraint. The majority of the time when you're taking diagnostic imaging, it's due to some sort of pain or needing diagnostic imaging. So you don't want to cause them that much pain. And then of course, the more exposure you get to radiation, the more likely it could harm your cells.
Explain the scientific reasoning for restrictions on pregnant women and people under the age of 18. Do not simply state because it is dangerous. You must explain why they are so much more sensitive to radiation.
So for pregnant women, they have a growing fetus inside of them, which with the exposure to radiation, it could harm those cells, causing miscarriage or mutation of cells in the fetus. For younger people than 18, everything's still growing, so you can harm the growth cells and cause them to have mutations. So one of the positioning aids would be a VTHT. So basically you could place your patient in this to be able to get your VDs and have them a little less stressed out. Another aid would be ropes. So that way you can tie it to your patient's legs to be able to get as far away from the exposure as possible. A third would be chemical, which would be sedation, whether that be oral sedation beforehand to kind of knock the edge off, or would that be fully putting them under to be able to get those diagnostic imaging. Okay, so to put on your PPE, you'll put on your gown. You want to make sure you strap all your straps and make it nice and tight to your body. You'll also put on your thyroid collar. You want to put your dosimetry badge on facing outwards so that way it can read. And then you'll place on your gloves. And I'm ready. So now to pull up an older x-ray that we've taken a few days ago, we can go to the database within 2 weeks. We can open this one. So you'll click on a name, click on the image you want to see, and then you go to viewer and it pulls up that x-ray. So to pull up an image to send out through your email, you want to pull up whoever you're going to send out. I might send out strikers. You'll click on the convert-export image. You'll make sure that it's on the user directory. You'll double click on the user directory and click on this one, make a new folder, and you'll title that with the animal's name. And then you'll click prepare and let that. Once that's been prepared, then you'll copy and burn it. So once I have converted that and it has copied, then you can minimize it. I've already pulled up the clinic email and placed in my name to send my rads to myself. I can then go to the attached file and click on the OS, click on his name and select all of them, open, and then I'll send them whenever they all load. Okay, so I've already put the information in, but then to register the setup, since we're doing a cat, we're going to click on the cat, we're going to do a front, we're going to do a VD, which is a cranial caudally, and then we'll go over here, we'll turn on our machine, click your AP, we're doing a front extremity and a feline. So now we're set up, and then I just have to adjust my centimeters once I measure in. So we'll then measure, we'll just take, so we're right at the 3, so I'll turn it down. Flip off the lights. I'm going to use a mechanical restraint of the surgical tie. Place that on so that way I can be as far out of the view as possible. Set up the right. We'll get him into position, so I'll have Brandy scoot him over, and she'll be holding his head out of the view. Okay. Okay, if you want to start. Okay, so we have him in position. I am scruffing him so he doesn't get too mad or too stressed out. We have it collimated down to just above the elbow. Okay. Okay.
I'll just
Ready?
shoot.
Yeah. Okay, so we're ready to shoot. We're doing, and then she'll pan over to show that he does not have a radius bone.
Hence why his name is Radius.
Okay, so to set up for the VD thorax on a canine, we're going to switch it to the canine. We'll click the thorax and we'll click the VD. So that's all set up. We will now measure her. We're going to measure her this way, just behind the scapula. Looks like we're going to be right at the 20. So I'll go to thorax, canine VD. And we'll move it up to 20. This time we're going to be using a trough, and I won't really need an assistant for the behind end to do anything, so she'll just be holding her steady in the trough to make sure she's not going one way or the other. Okay, so now that we have her in the trough, we moved it back just a little bit so that way it's just below the point of her shoulders, and then the crosshairs is going to be on either side of the scapula end there. My R is on the side there. A little bit crooked, so we'll straighten her back out. My assistant's just going to pull her hind legs back while I pull her front back. Give her a minute to relax here. That's a good girl.
Big scary noise,
Good
big scary
girl.
noise, big scary
Oh,
noise.
good girl.
Oh, good job, big scary
Alright.
noise. Stay.
Okay, so to be able to enter in information, I'm going to be entering my own dog that will be taking the hip x-rays on. So you'll want to go up to the register study. His ID is his personal number. His name, his family name is my last name. He is a male and he is 4 years old. So I'll register that. So it comes up here, and then I'll register my setup. I'll change it to dog. Do hip x-rays, and we're going to do a VD. So now I'm all set to take that x-ray. So to measure for the VD pelvis, you will want to measure at the widest point of the hips. And since we're going VD, so ventral to dorsal, he's a little excited. Then we will measure the thickest part here. It will stand up. So we're right at 17 centimeters. So then we'll go over to our x-ray machine. Press the AP. Since we're doing pelvis, we'll click that button. We're doing VD. It's already at 16, so we'll move it up to 17, and we are ready to take our x-rays. So to take the VD pelvis, you will want them in dorsal recumbency. Your crosshairs will be, you want just distal to the patellas and, there we go. Cranial to the crest of the ilium. And then to be able to get this view, you will want to pull the legs out and rotate them inwards. Keeping the pelvis straight. You want the tail aligned with the spine. Pull back.
Yeah, you're gonna have to rotate in a little bit more. Yep, and then go really hard. So take your hands and really rotate. There you go. See what that looks like.
Okay, for the contrast study, we're going to measure the abdomen here. So it looks like she's going to be right at 15. Measure that down. Right. We're going to get her into position, and then we'll put on our gloves.
Okay, it's all right, sweetie.
Yeah.
Hold on.
So I'm gonna put my marker in, which are crosshairs, just in line with what would be the umbilicus.
It's okay, honey.
So we'll have her all set up, and we're gonna put our gloves on. So, go. So now that we have her in position and I got my gloves on, then I can take the radiograph. And then we can show you, we've not given any barium yet. So we're gonna use our liquid barium. We're gonna give her a small amount. Just
Good girl.
give her a small amount at a time. Ooh, you like that one?
That's good.
It smells good. I know it's a lot. You're almost there.
Almost done.
Oh, good job.
Good
Wipe off your face, huh?
Good girl, good
All right, so now we'll take our second x-ray to make sure that it all got in there. Go. Okay, so we put her in the same positioning as before. We'll shoot our second x-ray. And we can show that she has barium in her stomach now.
Hello, my name is Brandy Bearden. I am a CVT and one of Chrissy's preceptors. I supervised her during all of her radiology videos. Chrissy has an excellent grasp on radiology. She did not need much help within this area. She was very proficient in knowing all of the positioning and all of the different methods of restraint, etc.